Good afternoon, everyone. All right, now we're in business. We're going to go ahead and get started. So if you haven't already done so, register and do all of that other stuff so we can be mindful of the time that we have here. My name is Denise Herbert, and I'm the Prevention Coordinator for Network 180. So again, I want to say welcome on behalf of the Kent County Prevention Coalition and really welcome you to our second annual Lunch and Learn. So we're glad to have you here, and we're excited to present this information to you today. Today, we're focusing on the feedback that we received from the community. So at our last, I'm doing two things at once here. So at our last Lunch and Learn, we tried to get some feedback from our community as it relates to what other series you wanted us to talk about. And so that's why we're here. We're here to talk about the marijuana, the cost of going green, marijuana in Kent County, and why it's a public health issue. So today, that's what our focus is on. Today, we're coming together as a community. So what we're doing is we are a learning community. So today, we will be providing you with several different pieces of information. First, we'll take a look at Kent County. So really giving you a snapshot of what marijuana usage, what that looks like here in Kent County. The second thing we'll talk about is the pop culture. How's that really influencing the decisions that we make, the decisions that teens make as well? And then last, it will be your involvement piece. So not only are you doing the neon piece of paper, not only are you doing we choose, I choose, we're giving you a call of action. So the call to action today, we'll talk about that a little bit further, but we have boards around the room that you'll leave your mark after today's workshop, and we'll get your input on that. So, with all that said, all of the housekeeping issues complete, actually we're going to go ahead and get started, and I'm going to turn it over to Brian.
Thank you. Thanks, Denise. My name is Brian Hartle. I'm an epidemiologist at the Kent County Health Department, and I'm also a member of the Kent County Prevention Coalition, and I chair the Community Epidemiology Committee, which tracks a lot of data around substance use behaviors in Kent County. And what I'm going to do today is, as Denise mentioned, is just provide you with a snapshot of kind of what's going on in our community around marijuana use, marijuana attitudes. Also present some data around what's going on nationally around marijuana. The first thing I want to discuss is just talking about data sources, which we talked about monitoring the future study, but the other surveys that we'll be talking about today are the Kent County Michigan Profile for Healthy Use study, which is done every 2 years, and that study surveys 7th, 9th, and 11th grade students in Kent County schools. It's administered by the Michigan Departments of Community Health and Michigan Department of Education. The Monitoring the Future study, which is performed by the University of Michigan, began in 1975, so we'll see some data all the way back to 1975 looking at previous use of marijuana, which is kind of interesting. And this is a national sample of almost 50,000 students. It's done as an online web-based school survey, and it's done for 8th, 10th, and 12th graders. So you can see a little bit of difference in the types of people that they survey. The national survey on drug use and health has been going on. It's administered by the Substance Abuse and Mental Health Services Administration. That's been going on since 1971. These are not computer-based. They're face-to-face interviews using computer-assisted training devices or survey devices. The population of 12 and older. So this is not just youth. It's all or people above the age of 12 in the United States who are United States citizens and non-institutionalized. It means they're not in jail. In the last survey, which was done in 2011, which we have results for, about 23,500 completed interviews were done in the population that we're talking about today, the youth population, which is 12 to 17-year-olds. So let's look at some data from the MiFi, first of all. This data, the MiFi asks kids if they've ever used marijuana in their lifetime or if they've had recent use of marijuana, which is within the past 30 days. And this graph shows that on the left is ever used and on the right is 30-day use. There's a couple trends to look at. Basically, 7th graders use the least amount of the least amount of 7th graders use marijuana, and the 12th or 11th graders use the most, which you might expect. As you get older, you're exposed to more, you use more. So that's not so surprising. Looking over the trends from 2007 to 2011, this is done every 2 years. we see some suggestions of increased use of marijuana, both in ever used and 30-day use of marijuana. Not in the 7th graders, but mostly in the 9th and 11th graders. So there's some suggestion there that marijuana use in those age groups are increasing. In terms of just looking at the overall picture, so this groups all those grade levels together, 7th, 9th, and 11th graders into one complete sample, looking at some of the demographic factors of the students. So overall, about 1 in every 10 students admits, and this is the 30-day use of marijuana, so about 1 in every 10 students admits to using marijuana within the past 30 days. Males are slightly more likely to admit use than females. And then in terms of race and ethnic groups, we see African Americans are the group that's most likely to report use of marijuana, followed by Hispanics, and then Caucasians are towards the end, or lower, about 10% of Caucasians or whites indicate use. Now this is what the question I asked in the survey. How does marijuana use in 30 days compare to tobacco use? As you can see across the board, more students are likely to report marijuana use in the past 30 days than tobacco use, which I find kind of surprising. You think tobacco might be a little bit more accessible, their parents might smoke it, easier to get, but really across the board, marijuana is more popular with our youth population. And as you can see here, there's not much difference between males and females, but then when you look at the race and ethnic groups, it really flip-flops. The white population is more likely to use tobacco, and the Hispanic population and African American population are less likely to use cigarettes. Now we talk about that National Survey on Drug Use and Health, and how does Kent County compare to the 12 and 17 through 17-year-olds in the nation. Although they're not perfectly comparable, we can kind of get some indication of where we stand, and our 10% is greater than the national survey in that sample. So about 8% of the national sample of 12 to 17-year-olds indicated 30-day use of marijuana, and again, males and females are both higher percentage of Kent County residents report use than in the national survey. One of the other indicators we look at is age of first use, when kids start using these substances, and I presented data here for both alcohol and marijuana. And as you can see, marijuana they delay the onset of use a little bit. The average age of those who've used it in the past is 14 years of age, so 14-year-olds, it's about freshman year of high school when people start using. A little bit higher or older ages than for alcohol. And then you can see the Hispanic youth that completed the survey are the youngest individuals to admit use of marijuana. Another data source we can look at is offenses for data from Michigan State Police. This is from the Incident Crime Reporting System to kind of give an indication of who's being charged with offenses for possession of marijuana, like MIPs, minor in possession of alcohol, minor in possession of marijuana. And this data comes to the state police, and it's for 18 years of age and younger. So this just presents data from 2008 to 2011. As you can see, the offenses for marijuana in the state database have increased over those years. So in 2008, it was just over 400, and from 2009 to 2011, we've seen an increase in offenses for marijuana possession, pushing upwards of 500 for the county of Kent. And correspondingly, the offenses for alcohol have been going down a little bit. So we're down to under 300 for MIPs for alcohol, and we talk a lot about our prevention providers who do work with kids who get MIPs. And Patty Warmington's in the house today, and she indicates that anecdotally, what she's seeing in her programming is that more kids are coming in for marijuana offenses than for alcohol offenses. This is data from the national survey, just to look at what's going on nationally, comparing to Kent County. And as you can see, this is a national survey on drug use and health. And since 2006 really was kind of the time we reached, bottomed out in terms of use. We had seen a nice decline in national use of marijuana over that time period from the early 2000s to 2006, but ever since 2006, 2007, we've seen a steady increase in the percentage of kids who admit to using marijuana in the past 30 days. This is similar to the Monitoring the Future survey, which again we talked about going back to 1974 1974, which that's the year I was born, so you know how old I am now. But back then, you can see that a lot of kids, these are 8th, 10th, and 12th graders. The survey actually started just in 12th graders, so that's why the data going back is only for 12th graders in red. So as you can see, compared to back in the 70s, you know, our use is not quite that high. Back then, use in the last 12 months was about 50% of kids had used alcohol or marijuana in the past year, and about just under maybe 11% used it within the past, or used it daily. These are daily and yearly figures. But if you just look at kind of the last couple of years, since about 2008 is really when we started to see that increase again of marijuana creeping up in all age groups really, and just last year in 2012 it finally plateaued a little bit and didn't increase as it had been increasing over the past 5 years or so. So we see increase in use locally and nationally. Some questions as to why. Why is this happening? Some of the reasons potentially for this occurring is that in these surveys they ask kids how they perceive the risk of use to their health. How harmful do you think marijuana is to your health? And what they've been finding is that fewer teens today report seeing any danger in the use of marijuana. So this perceived risk they talk about has been falling over the past 5 years, so it's kind of corresponding with the increase in use. And also teens' disapproval of use, so teens disapproving their peers using has also declined. So it kind of indicates that those social norms against use are falling off over the past couple of years. And this is just some data again from Kent County's Michigan Profile for Healthy Youth. This just kind of looks at the risk of harm and the perceived risk of harm that youth have around alcohol use and marijuana use. As you can see across the board, marijuana, perceived risk of harm for the use of marijuana is lower than alcohol locally. And we kind of see similar trends to the previous slides that we saw in terms of use. So males have a lower perceived risk of harm than do females. Females are the most, they think it's bad. So nearly 80% of the females think marijuana use is harmful to their health. So males, about 60%. And then African Americans, 61% say marijuana use is either very risky or somewhat risky or moderately risky to their health. And then the white population is a little bit higher than that. So it really kind of flip-flops what we saw before in the use graphs, where those who don't see it as harmful are the ones that are using it the most or admit to using it the most. Again, looking at it by age groups, this is not, again, surprising. Perceived risk of harm drops off as the kids get older. But I think, what's interesting in this graph is just the fact that 7th graders, who in my mind, born in 1974, now I'm kind of old, 7th graders who are, 13, 14 years old, only 3/4 of those think that marijuana is harmful to their health. So I think that it's an interesting statistic. Now, the Michigan Profile for Healthy Youth has been done in Kent County 3 times, in 2007, 2008, 2009, and 10, and in 2011, 2012. And this graph here compares data on perceived risk of harm from that first survey in 07-08 to the most recent survey in 2011, 2012. And as you can see, it's dropped dramatically, the percentage of kids who perceive the use of marijuana as harmful, going from 76% in 2007, 2008 to 68% on the most recent survey. And again, we see similar to the previous graph is, males, African Americans, Hispanic youth are the ones that, again, have had a large drop-off, but really the drop-off has been across the board. Nationally, we see similar data. We see it really bottomed out in the 70s when people did not think that marijuana was harmful at all to their health. And as we went through the 80s and 90s, early 90s, it really reached its peak of kids thinking that marijuana was harmful. And really ever since then, it's kind of dropped off slightly until, like I said, just in 2006, 2007, where it really has bottomed out. The slopes of these graphs really went downward. The green is the 8th graders. The blue is the 10th graders, and 12th graders are in red. So you can see that the slopes of those graphs are pretty drastic decline in how kids perceive the risk of harm to their health. This is data from the similar survey, the National Survey of Drug Use and Health. So in 2007, 54% of 12 through 17-year-olds thought marijuana was a great risk to their health. In the most recent survey in 2011, that dropped all the way down to 44%. So again, we see it locally, we see it nationally. Kids are just not thinking that marijuana is that harmful to their health. Another thing to look at is how easy kids think it is to get these substances. So they ask, is it easy or sort of easy, not easy, very hard to get marijuana if you want it. And these data show kids who say it's easy or very easy or sort of easy to get marijuana. As you can see, 4 out of every 10 kids surveyed said it's pretty easy to get your hands on marijuana if you need it. Males and females, there's not much of a difference there, but then you do see quite a bit of difference in the race and ethnic groups. Almost 2/3 of African Americans admit to saying, it's pretty easy to get this stuff if I want it. And just under half of the Hispanic population that's been surveyed indicates it's easier, very easy to get marijuana. These aren't quite as, if you look at the alcohol numbers, they're higher. So a lot of kids find it easier to get alcohol than marijuana, but still these are numbers that are fairly drastic. Then another thing that we talk a lot about in the coalition is how youth perceive their friends using. How accepting are they of use, and what do they feel like the kids are doing these days? I know when I was a kid, you kind of thought, what are the cool kids doing? I wasn't very cool. Are they using, and you perceive what's going on in your school. These are questions that ask the kids, how many people do you think in your grade are using marijuana or have used marijuana in the past 30 days? And these are the kids, the percentages in the 3 age levels that responded as none, like no kids in my age level or grade level are using marijuana. So 57% of 7th graders thought no one in their grade was using marijuana. Only 13% of 9th graders and just 5% of 11th graders thought that no one else in their grade level used marijuana. So that's quite drastically low. Whereas we saw the prevalence data where 99% of kids in 7th grade don't use marijuana or don't admit to marijuana use in the last 30 days. 89%, almost 90% of 11th graders have not used marijuana in the last 30 days, and 80% of 11th graders. So really the perception of kids is much higher of what the use is in their grade levels than what is reality. So these are social norms that we need to impact. So some just of the reasons why kids maybe thinking things are less harmful, or these substances are less harmful. The Michigan Medical Marijuana Act, which was passed by Michigan voters in 2008. So we talked about the debilitating conditions, nail patella. So if you have one of these debilitating conditions, you're diagnosed by a physician who will provide you with a form to provide to the Michigan Department of Community Health to get a registry card for medical marijuana for medicinal purposes. You can get one. And I'm not going to go into all the details today, but basically you can possess up to 2.5 ounces of medical marijuana. So if you're caught by the police and have medical marijuana or marijuana on you and you have your card, you can carry up to 2.5 ounces of that. You can also grow plants in your house in a closed lock facility, which they just really put some more stipulations on what that actually means, what a closed lock facility is, because there wasn't really good definitions on that previously. So you can grow up to 12 plants in your household in a closed lock facility. In addition to being a patient who receives medical marijuana, you can also be a caregiver to someone else. So if you're under 18, you have to have a caregiver providing you with medical marijuana. So those caregivers can do the same. They can carry 2.5 ounces, they can grow 12 plants. But if you're a patient, you can also serve as a caregiver to up to 5 other patients. So if you have 5 people you're taking care of, you can grow up to 72 plants in your household. 12 for you, 60 for your people you're taking care of. And also, you can carry 2.5 ounces per patient that you're taking care of. These are the qualifying conditions, the list of them: cancer, glaucoma, Hep C, AIDS, things that were presented in the previous survey that we did. And then some of the things are any medical condition that leads to severe pain, chronic pain, severe nausea. Those are kind of ambiguous types of things. And if you can find a physician who's going to write you basically a prescription, not really a prescription, but allow you to fill out the form, then you can get access to medical marijuana. I think what this does is just make kids think that it's a pharmaceutical drug. Like, we talked about prescription drugs. If a doctor says it's okay to use it, kids are less likely to think it's risky to their health. So this law that was enacted in 2008 potentially has some impact on that. Then recently in 2012, just this past November, Grand Rapids voters voted to decriminalize recreational marijuana. So really it looks at creating a civil infraction as opposed to a misdemeanor for possession of marijuana. If it was a misdemeanor, you could get a $1,000 fine and up to a year in jail if charged and found guilty. Whereas now it's a civil infraction, so you're just going to get a ticket. So if you're found with, walking down Division with, less than 2.5 ounces of marijuana, it's a $25 fine. If you're caught again, it's a $50 fine. If you're caught again and beyond, if you keep getting caught, it's a $100 fine after that. So it's very different, from going to jail and paying $1,000. It was delayed by the county prosecutor for a while, but finally on May 1st, the city manager finally enacted this charter, this executive order that implemented this law. But there's still some stipulations if you have more than 2.5 ounces, or if there's some indication that you have intent to deliver, you can still be charged criminally as a misdemeanor offense. In addition, decline in prevention messages. The kids aren't getting as many prevention messages from things like above the influence and what we do here in Kent County. So a study that was done by SAMHSA showed that media messages have fallen quite a bit over the course of about 10 years. The kids being exposed to these messages fell from 83% to 75% in 2011. And even when you're going to school, the messages that you receive from these national campaigns in schools have fallen off dramatically. And overall, the ATI, Office of National Drug Control Policy, has a budget of $20 million for the entire country. And a lot of that funding has been threatened to cuts, and I think this past year they only got a $20 increase in that budget. So you can see that not a lot of money is going to these prevention messages for youth in our community, but things like the Kent County Prevention Coalition, that's what we are trying to do more of, and having you here today is an important step in that process. But really, it's still a dangerous drug. And just last week, I think about 1 week ago, the Mayo Clinic out of Minnesota put out a release that indicated that they do not recommend medical marijuana for the treatment of adolescents with chronic pain. One of the main author of this article said consequences can be very, very severe, particularly for adolescents who may get rid of their pain, but it's at the expense of the rest of their life. So, some of the adverse effects of marijuana, the short-term effects are fatigue, impaired concentration, slower reaction time. So you can think about how this impacts your work, your school, driving down the street. Really puts people in danger if you are getting behind the wheel with this in your system. Other effects, dizziness, anxiety, and other impacts from higher doses of marijuana. Some of the studies that are out there have shown that use of marijuana before the age of 16 can lead to higher likelihood of individuals developing psychotic effects later in life. And this graph kind of just shows you that basically you double your risk of future psychotic symptoms, mental illness, like depression, anxiety, schizophrenia, things like that. The green kind of shows you exposure to marijuana and how it increases your risk over your lifespan to have these psychotic symptoms. And then it's even worse if you are exposed to marijuana in adolescence and then are exposed to it again later in life. In adulthood, you again expose yourself to that. So, and then another study really looked at use in adolescence really impacting cognitive function of kids. It impacts the brain, areas of the brain that are responsible for learning and memory. So they did a long-term study, followed kids over time, assessed their exposure to marijuana and assessed their cognitive function through IQ tests. And those who were exposed to marijuana at a young age, their IQs were 8 points less than kids who did not use marijuana. So, and this is not something that can go away. So even for those kids who stopped and are not still using, they still saw that impact on long-term cognitive function in these kids as they grew into adults. And then the hard part about marijuana is that, you know, it's addictive. And the younger you start, the more likely you are to become addicted to that. This stat just says 1 in 10 users become addicted, and those lower than 25 are more susceptible to addiction. We talked about this. You know, doubles the risk of getting in an accident, you know, if you have a marijuana in your system, and then if you combine that with alcohol, you know, that's even more dangerous. These are just two quotes that I want to end with, because my time is up. Just really impactful, you know, for youth. And these were researchers who took part in these two studies that I just presented. Parents should understand that their adolescents are particularly vulnerable, so really looking at, you know, use in youth, you know, those kids that are under the age of 18. And this final one is I think, the most powerful. You know, talking about how marijuana is very dangerous to the brain, particularly in adolescence, and it's much more dangerous than we've ever given it credit for. So just some things to think about as we go throughout the day to our next hour and a half or so. And I think that's it. So, what? Thank you. Greg DeLeon is one of our youth Dream Team members from our Youth Coalition. Unfortunately, he's not able to be here. Some of you may know him who are there. Yeah, he's a good guy. So what Greg's been doing is he's been going out into the community and asking kids, I call you kids, youth in the community about what their perceptions of marijuana are. He was at the Youth Summit, you know, with his iPad taking interviews. So what Greg has done is put together a video around youth perceptions around marijuana for us to partake in today. So I'm going to start that up, and how long is it? It's just almost 6 minutes. So we will do that, and then I'll bring up Michelle.
To have a good time, to get high.
Teens use marijuana to help them relieve their stress.
I think it's because of peer pressure also.
Teens use marijuana because they like to have fun and they have no better way to have fun.
It lowers stress.
Because their friends use it, because they think it's cool and they see other people doing it.
Chill out and relax.
Reality or abuse in the house, or because it's around and they want to forget their
Because they want to fit in.
Because they're peer pressured by their friends.
I think they use it for like either stress or like because they just want to have
To
fun.
escape their troubles at home or whatever they're going through, and some use it for recreation.
They like the feeling, they like how it goes through, they like how they act.
Society paints a picture saying that if you do this, you're cool, and you want to be cool, so you do things to fit into society.
Or maybe in TV shows, they hear it from their friends, talk about it from their.
I think either like through schools or like people that they know.
They see it, grown people doing it, other people that they look up to doing it, so I think it's okay.
By friends, seeing it in movies, famous people.
In a lot of music videos, people distributing it and having it, smoking it, and then kids think, ooh, that look cool, and if they ain't getting in trouble, I can do it.
Any type of entertainment, there is
advertise positively through music and movies.
Advertised through movies, videos, like
With their friends.
Rappers, TV.
In the streets, movies, entertainment,
It's
like
advertised
music.
all over the world. TV, movies,
streets, everywhere. You can find it anywhere.
Yes, because you can get cancer, you can get other types of diseases.
I don't really think it's dangerous because, like, so many people smoke here.
It's a yes and no. I mean, some people smoke marijuana because of the health, and that can go one way or another. The other reason it is dangerous because it kills brain cells and it lessens teens' ability to focus in class.
If you become addicted to it,
I don't
become
think
a
so.
drug addict.
I mean, it could hurt your lungs, but other than that, it doesn't really lead to
Marijuana is
other
not
things
dangerous.
like
It's
that.
actually healthy for other people. Marijuana
It
is a
is
medication.
dangerous because, like, it's not good for your health or for yourself.
Marijuana is dangerous necessarily because I guess when you smoke, it doesn't really make you do dumb stuff like hard drugs or like it is illegal, and I don't think people should do it. But I don't think it harms anybody else.
Yeah, it's dangerous if it's blackening your lungs and could cause cancer.
Yes, because it makes you do stupid stuff. And it
Not
kills brain cells.
necessarily because it helps with pain.
I think it's dangerous. I think a lot of people die from using drugs, and teenagers don't understand that just because somebody else can do it, you think you should do it too.
What keeps me from using marijuana? School, education,
I think about my future
graduation.
because some people do get
I
addicted
prefer
to
to
it.
find other coping skills rather than
I
smoking.
probably wouldn't like the aftertaste, and I wouldn't want to be like everybody else.
I don't use marijuana because it's a waste of time, it's a waste of money, and I have better
I don't
things
want
to
to
do with my
like
life.
my lips turn black and everything, and I see how it affects like
I
teens
just don't
around
like
me.
smoking. I don't see it doesn't, do nothing for me. That's just not what I would want to do. I don't smoke at all.
It costs too much.
Because it kills your brain cells, and my parents, they keep me from doing it too because
I don't want to smoke just to feel better about myself.
Can't afford it.
I realize Greg is not here. He took the lead on this video here. Hold on one second. I'm struggling doing multiple things at the same time. Okay. There we go. Yeah. No. Okay. Give me one moment. Okay. There we go. Yeah, we definitely appreciate Greg on that one. We had initially asked, let me back up. My name is Michelle. My name is Michelle Stitt, and I'm serving as artistic director for the Kent County Prevention Coalition. And it's kind of one part artistic director, one part administrative help, and going into the schools to talk to youth about all things above the influence Kent County and what it looks like to live a life above negative vices, essentially. But we worked with Greg towards the end of Red Ribbon Week. We had worked with him to develop a short video to kind of report out on activities that they did there at Central High School. And so when we saw the work that he had put together, we're like, hey, we need your help in another arena. So I had approached him about putting the video together, and he jumped in feet first. So, and we're super proud of him. He's at U of M, which is why he's not here. He started early in the summer program for the engineering program there at U of M. So big shout out to Greg, even though he's not here. If we could clap it up for him. So super proud. But all that being said, Brian talked a bit about data and gave us the nuts and bolts with regard to surveys and that data piece. Saw the video and got kind of the teen perspective with regard to marijuana use, kind of at the ground level. I want to talk to you a bit about, want to kind of shift gears and talk a bit about pop culture, media, and incorporating some of that teen perspective. But want to talk a bit about that. So my first question up is, what do you see? This kind of ties in with the next slide. as an artist, I'm super visual. So there might not be a whole lot of text that you get, but we'll do kind of some watch and discuss pieces with regard to what you see here versus what I share here. So, but looking at what do you see? The question that's asked is, what do you see? And essentially looking at media's influence on youth. So that image there. Several images here with regard to I know there's some images up here that portray youth that are younger than that 12 to 17 Generation Y and Z sort of population. But if we're looking at the influence of technology and media on youth as a whole, we kind of did a mashup of photos to kind of represent that. And the one that's the most striking to me, I want to kind of walk over, but it's the one on the bottom right-hand corner, looking at the infant in utero with the cell phone. Like you always see kids in stores playing on their parents' cell phones. This is just crazy to me. It boggles my mind. But we're looking at young people today are called a lot of different things. And one thing that stands out, at least to me, is referring to youth, teens, that Generation Y and Z, again, population as digital natives. And given that that image is so vivid, even though that kid is clearly younger than that 12 to 17 population, that had to be included because it's just so profound with regard to the influence of technology on young people. So studies show that Generation Y and Z population of youth are it's the first generation whose beliefs and values, core values, will be shaped not just by parents and adults. Their core values and beliefs will be shaped by what they see in the media, technology, on the television. So when you think back, just flipping through the television stations, if you think back to different reality shows that you see and think about those images as being images that affect our young people today and impact and help to shape and mold what they believe in, what they choose to believe in, it can be a little scary. But by the same token, it's a look that something that we do have to look at to be able to know kind of how to approach certain conversations, how to talk to teens about all things substance abuse prevention. So, here again, also looking at digital natives versus digital migrants. Digital natives, like I mentioned, is that 12 to 17 age range. Just by a show of hands, who in here can remember a time before the internet, really? Just by a show of hands, before the internet. Okay, so just looking around, those folks whose hands were not raised, clearly Generation Y and Z babies, not babies in a negative way, baby, I love you, but babies essentially, folks who from very early on knew to Google what they wanted to know. If they had a question and someone close by didn't have the answer, they go to Google, whereas we might go to, I go to Google, but that's just me. But we might go to a book or to the library or something like that. Our digital natives are going to flock to the internet or other portals like that to glean information from. The folks that raised their hands are more in the digital migrants camp, where basically, I'll flip to my next slide there. There's kind of a rundown of differences to kind of compare and contrast digital natives versus immigrants. And just a couple that I will pull out. Even the structuring of this presentation might speak to digital migrants or natives in different ways in terms of how visual the presentations are or are not and the like. Speaking about the third bullet down on the digital native side, pictures, sounds, video before text tends to speak to our digital natives. With regard to, I mean, you can look at anything from our Instagram challenge, which was in part specifically geared to kind of pull in that social media element, but that highly visual, highly just in your face, this is what we're doing kind of a thing, speaks to that sort of digital native side, and kind of it speaks to those folks from that camp. You say Instagram, they're there. You say, you know, photo sharing, this, that, and the other, they're on board, and kind of piques an interest in a different sort of way than just words on a page. And then conversely, on the other side, there are several descriptions for our digital immigrants where, okay, looking at the very bottom one, tend to like information presented in a very linear, very logical, very sequential sort of a way, sort of a this plus this equals this. Doesn't necessarily have to have all the frilly pictures, and ensures that visual piece doesn't necessarily have to be there, as long as this plus this equals this, they're good, typically. So there are a few exceptions to the rule, so I don't want to put anybody in a box if you're not, you know, feeling one way specifically or the other. But for the most part, it's kind of one camp or the other, speaking about that Generation Y and Z versus other. So, I have a quote here that I won't read. I'll leave it up here so you guys can mull over it a bit. But it talks about the differences between digital immigrants versus digital natives. And really what we're looking at here is a paradigm shift, a shift between how folks glean information, how they form opinions, how they view the world, how they process information. That is critical. If we're going to talk about youth and prevention, we need to make sure that we understand that we have to approach prevention, substance abuse prevention, in a specific way so that we're reaching our target audience. So, and by no means, I feel like this should have been the disclaimer at the top of the presentation, by no means in looking at the kind of contrasting migrants versus natives, by no means are we implying that youth or teens are foolish for gleaning information a specific way. The point that we're looking at making is that teens tend to be very impressionable. That 12 to 17 age range is a very impressionable age. The voices that they hear from friends and peers and the like make an impact. And so by that same token, we need to make sure that those things that we're speaking about, or the messages that we're putting before them, we need to be aware of the messages that are being gleaned from those images. So just that impressionable factor. And I love the visual there with the girl with all of these different sort of pop culture references, from skinny jeans on her cheek to LOL and that sort of tech speak on her face, and all of those different things that kind of make up who she is, and her kind of putting forth this certain image based on based on what she's gleaned from pop culture, those things that she's chosen to subscribe to. So at this past May's Above the Influence Kent County Youth Summit, we did several surveys. One of the surveys that we did, we asked teens where they see marijuana messaging. And a lot of things came up. One of the huge things, the front runner in that question regarding marijuana was, as far as where they're seeing messaging, was on Instagram. And I'm on Instagram, but I'm not on Instagram like that. And so after seeing that and knowing that, knowing a few things, I figured, I'll delve in a little deeper, kind of check it out, walk around in there a bit and see kind of what's what, instead of just taking my own photos and posting them and for the world to see, or my folks who follow me, or whatever. So that being said, delving in, there's a lot. There's a lot. It's essentially a stage, a platform for folks to share. Instagram, as you well know, photo sharing website. And essentially what is done is folks use that as their stage to be able to put forth an image of themselves. Good, bad, or ugly, they're able to project what they want to project, kind of control those images, take the photo, customize it this way with this filter, and have the photo look this way or that. By the same token, pop culture icons, i.e. Rihanna, Miley Cyrus, are doing the same thing. The difference between a random community teen doing it and like a Rihanna or a Miley Cyrus or a Justin Bieber or whomever is the fact that these folks have millions of followers and have millions of teens sitting, kind of at their feet, at their beck and call with eyes wide open, kind of waiting and watching to see what they're going to put forth. So typically on Instagram, it's kind of run-of-the-mill pictures. Hey, I did this today. Hey, I went here, and shooting a picture of it, documenting it, and putting it out there for the world to see. Fine. What raises a few questions is when that's done, and it's related to all things marijuana and the whole marijuana culture. So what it does, it sets up this sort of how Brian talked about the teen disapproval rates of marijuana declining. It sets up this thing that says, well, I'm hearing over here that marijuana is okay, or I'm seeing over here that on some level it seems to be okay because it's being used in a medicinal fashion. And I got Rihanna over here, and she's, smoking up this and lighting up that, and is, putting forth those images for the world to see. So it might be okay, it might not. So the same way that she's putting forth those images for the world to see, our teens are looking at those images to be able to kind of make meaning and decipher for themselves what they're okay with, what they're not. And so it's that whole issue of the decreased perception of harm that kind of comes into question here. So just by a show of hands, who saw this movie last summer? I'm curious. I feel like I want to count all the youth, all the teens who saw this movie last summer. No judgment, just a question. I want to show you a clip, and and then we'll do a little watch and discuss. Okay, I don't know if I love or hate the last line. Take pride in that. Like, really? So, no judgment to those of you who saw the movie. No judgment at all. But essentially what we have going on here is, let me get back to there we go, is Seth MacFarlane of the Family Guy fame and all like this, and he kind of does this adult humor, and it's a lot of times portrayed in kind of childlike ways. So adult content on cartoons, or adult content with teddy bears. And it kind of, he takes those things and kind of turns them on their ear, which is kind of cool and creative and all like this. But I honestly don't know if he intended on his audience being mostly teen. However, it caught on with our younger generation of folks. And to kind of have something like this put forth to teens, and it kind of, it makes it kind of a normative thing that when we're looking at social norming and all like this, to see just a casual conversation over, a pipe, like it kind of, for me, it raises a few eyebrows with regard to whether or not it's appropriate and all like that. So, and then it plays back into, like I said, the decreased perception of harm that we were speaking about earlier. So All of you, when you came in, you received a packet that looks like this, an envelope that looks like this. And within that envelope, there is a sheet of paper that looks like so. If I can have you pull that out real quick. And if you have a pen handy, if you pull that out as well, pen or pencil. We're not particular. And I have an activity for you, so we can kind of get your minds working a bit. There are several questions on this, this worksheet, about 5 questions on this worksheet. If I can have you turn in just a moment, I'll give you your directions, and then if I can have you work this out, and then we'll come back together. But I do want to read you one last quote by one of my favorite authors, and it's Dr. Seuss from the Lorax, and he says, "Unless someone like you cares an awful lot, a whole awful lot, excuse me, nothing is going to get better. It's not." We've painted a bit of a bleak picture in certain ways with regard to the perception of marijuana being on the decline and use being on the rise and things of the like. However, we've also empowered you with a bit of information with regard to ways to approach prevention, ways to approach conversations that are very tangible things that you can do. But we're not the only ones with ideas. So with that being said, Ms. Denise Herbert is going to lead you guys in the evaluation portion, and then you can go forth and populate the banners with your Post-its. There you go.
Yes, we don't want to populate yet. No, we don't want to do that. We just want to be mindful for the time. And just a few last pieces, housekeeping issues, or items, I should say, before we depart. First, when you registered, you received an evaluation. What we do need is for you to complete that evaluation. Again, your voice is very important to us. And then one other thing, in order for you to receive your certificate for contact hours, we need you to return the evaluation. So that's one thing, again, very, very important. Gentlemen in the back, have space at the bottom of this for you to provide your input as well. One of the other things before we depart, we mentioned the I Choose, We Choose project. If you would stop by the booth to leave your departing comments, that would be greatly appreciated. Again, leaving your kind of footprint in the community to kind of inspire others to kind of do this work in prevention. The last item, the testimonials. I mentioned this at the beginning of the series, so if you would, coalition members, what does it mean for a coalition member, and then what does it mean for a community member as far as getting involved in the work in prevention. One of the items that we don't have on this sheet is for you to leave your name. So if you would, jot your name down, indicate your organization, your name, your program. So then actually in future literature that you see from the coalition, you'll see your kind of testimonial. So again, very important. I choose, we choose, and then your testimonial piece of it. Michelle, okay. Michelle mentioned the call to action. So first of all, before we let you go, we want to thank all of our sponsors. We want to thank you for attending today's workshop. For other workshops, again, put information on your evaluation sheet. That would be very important to us. So with that last comment, I guess I'm going to let you go to populate, as Michelle said. So before you leave, complete those pieces of information, your evaluation, and then as you leave, check out the boards to see how you can leave your lasting imprint in our community. Thanks for coming.